Good evening, everyone. Welcome to tonight's edition of Road to Success, where we'll be talking about children's food allergies. We are honored to have with us a guest facilitator this evening, Sherry Eisler. Sherry is a mom of two, a nurse practitioner in Orange County, and she'll bring to us not only her professional experience, but her personal experience as a mother of a child who suffers from food allergies. Before we get started, I'd like to take a moment to introduce the members of the Executive Committee, our Board of Directors, and staff members who are with us. I will call your name in the order that I see you on my screen. All right, first off is Karen Mazzola, Vice President of Educational Development.
Yeah, good evening and welcome. Thank you.
Lawrence Claremont, Vice President for Leadership Development.
Good evening, everyone. Thanks for joining us tonight.
Maxine Lures, President-elect.
Hello, everyone. Good night. Thank you for joining us.
Jude Bruno, Treasurer.
Good day, everyone. Welcome.
Bert Miller, Vice President for Regions and Councils.
Good evening, everybody. Thanks for being here.
Those are the members of our Executive Committee. Board of Directors, Kay Hawkins, Central Region Representative.
Hi, everyone.
Kimberly, are you recently elected to a position? Refresh me. Kimberly, not Adamski. The other
McDonough, yes, ma'am. Madam President. Hillsborough County Council.
That's
President.
right. Incoming president, right?
Yes, ma'am.
All right, thank you. We also have with us, let me go to my next screen. All right, I think that's all the BOD we're fortunate to have with us our compliance guru, Kimberly Adamski, the other Kimberly.
Hi, everyone. Good you.
Thank you, Kimberly. I think that, Vanessa Blazek, who is our Pasco County Council President.
Hey, everyone. Thank you for being with us.
Thank you. And I think I've gotten everyone. Did I miss anybody on the board, staff, or executive committee who may have joined us a little bit later? I don't think so. So I'm really happy to turn the floor over to Sherry. We had a really good discussion earlier today about food allergies, and people shared from a personal perspective, not only about their own children, but about the issues that they have encountered, some of the steps that they were able to use to get over some of those hurdles, and offered good advice on how to move forward with your child in a system that may not be as accommodating as it can or should be. Sherry, please tell us a little bit about you and let me know when you're ready for me to start the presentation.
Okay, thank you so much. Yes, my name is Sherry. Thank you all for being here and allowing to just spending this time with me to discuss anaphylaxis in public schools. It's something that's been overlooked for far too long, and it's had deadly consequences. I am a mother of two. My kids are 5 and 7, and my oldest, who's 7, has severe anaphylactic food allergies to dairy, peas, chickpeas, and lentils. I found all this out when he was a baby. So it's just been it's all that I've known. However, when I enrolled him in kindergarten in public schools, my world turned upside down. The summer prior, I disclosed all of his food allergy information, set up his EpiPens in the health clinic and everything. And then I also signed him up for the before and after care program, contracted through the school district on campus, thinking he would be the safest for continuity of care. His EpiPens are there. I also had his physician sign a form that he can self-carry EpiPens so that they're in his lunchbox with him at all times. And when the very first day of school, so I also disclosed his food allergies and EpiPens to the before and after care program. And on the first day of school, when I went to drop him off, I went to them and I asked, just to reiterate protocols. Oh, okay, this is my son. His EpiPens are in his lunchbox. These are his signs if he has any. And then she just looked at me and said, oh, we don't do EpiPens here. I was like, what do you mean you don't do EpiPens? Like, I disclosed all this information. Nobody told me. And they said, no, we'll call 911. And I said, no, my son's reaction is his airway. His throat will close and he will die before an ambulance even gets here. And they said, well, no, like he's not safe in our program then if he can't give his own EpiPen. We don't do those. And then a couple hours later, the director of the program called me and told me he needed to be withdrawn immediately, that he was not safe in the program. When I was just saying, this is discrimination, he's protected by the ADA, Americans with Disabilities Act. She then went on to tell me that she had kids on 6 different campuses with EpiPens, and I was the only one giving her trouble about it. I asked, did you notify those parents that they won't be getting EpiPens like in your program? She skipped over that question. I wound up calling the school district. I live in Orange County, so OCPS, the 4th largest school district in Florida. I got the runaround and then maddeningly talked to several people who said, oh, I've known about this situation, but usually a workaround can be made. I was like, so you guys are aware that students are being discriminated against and you're not doing anything about it. You're just allowing it to happen. And that just sent me on a journey. I've talked to other parents, and I even met with some Florida lawmakers, my own local representatives. And I'll get into that later about trying to file laws because it varies widely in the whole state of Florida. Palm Beach County is one of the more progressive counties when it comes to food allergies, and their school district actually has a policy regarding anaphylaxis, but most counties do not. So we can start the slideshow now. And so this is my presentation just to discuss anaphylaxis in public schools, to discuss how we can ensure the safety and inclusion of kids with food allergies. So on the next slide, what is anaphylaxis? That is my son there in that picture. And what people need to understand is that food allergies and anaphylaxis are a disease. It is not a diet. It's not a dietary preference. It's an actual physical immunologic response to something that your body is seeking as an allergen. Anaphylaxis is the most severe form of an allergy, and it can be severe, and it can be to food, bee stings, medication, and latex, amongst other things. And food allergies are a growing public health concern that affects approximately 8% of children, which is an average of 2 in every classroom. Food allergies have more than doubled in the last decade and affect approximately 6 million children, including more than 235,000 children in Florida. That number is the number that we know. However, it's estimated that there could be even 10% or more, and that is thought to be in our population of kids with Medicaid. Kids with Medicaid often don't seek medical care like they should, and so we think that they're being underdiagnosed. 40% of children with food allergies have been treated in the emergency department for their reactions. And the CDC, Florida Department of Education, and American Academy of Pediatrics, amongst other organizations, have all published guidelines recommending for teachers and staff to have training on recognition of anaphylaxis. However, again, without any law or mandate, this is just optional for school districts and teachers. On the next slide, I have some children who have died from anaphylaxis at school. The cheerleader up there was a high school senior, and she was exposed. I think she took a bite of a cake or brownie at her winter formal, and she had an allergic reaction, and she died in the hospital. The little girl in the middle there, Emerson Kate Cole, she died just last year in Texas. The boy next to her, he died from a reaction at school. The school nurse didn't recognize his signs of anaphylaxis and tried to treat him with Benadryl. And then about 10 to 15 minutes later, when his symptoms progressed, then she gave him EpiPen, but it was too late, and already that 15-minute window, and he wound up dying in the hospital. The little boy with the glasses, he's from the UK. He died by bullying. He was severely allergic to cheese, and his classmates knew it, but some bullies put some cheese down the back of his shirt, so he didn't even eat it. It caused such a severe reaction in his airway that he was in the ICU for days, and then he eventually died in the hospital. The boy with the umbrella, Elijah, he was 3 years old in New York and he was allergic to dairy. The daycare staff knew it, still accidentally gave him a grilled cheese, and he died from anaphylaxis. On the next slide, it talks about the signs of anaphylaxis and severe symptoms. A lot of the minor reactions can be like, oh, I have a stomach ache, sometimes just vomiting. But if there's ever a two-body system reaction or the severe reactions that include the airway. So for some kids, especially young kids, they don't know how to describe it. They'll do this, or they'll say, my throat is scratchy, my throat is itchy, it doesn't feel right. But their throat is actually closing up from swelling. And once your throat closes up, you can't breathe. It can cause shock, trouble breathing, chest pain. You can get lightheaded and confused because your blood pressure is dropping. A lot of things happen very quickly in anaphylaxis. And epinephrine is the only FDA-approved treatment for anaphylaxis, and it needs to be administered immediately to avoid what's called biphasic reactions. A biphasic reaction is when you have an allergic reaction. Sometimes people try to treat or they don't know, and so they try to give like Zyrtec or Benadryl. It can alleviate the symptoms a little bit, but then they have a more severe reaction, sometimes even 8 to 12 hours afterwards. And that's when a lot of people run into trouble with anaphylaxis and die from for that biphasic reaction for delay in epinephrine. And sometimes more than one dose of epinephrine is necessary. You used to, 20 years ago, when you bought EpiPens, because they're so expensive, you used to be able to just buy one. But more than a decade ago, the FDA said, nope, it has to come in a 2-pack, because they know now that with the severity of allergies rising and worsening, that sometimes more than one dose is necessary. 25%, this is very alarming, 25% of children who receive epinephrine in schools have no known allergy at the time. This means that they don't even have a prescribed EpiPen or a plan. But most schools do carry stock epinephrine that they can administer to anybody. Not all schools do though. But 25% of children, that's very scary. And the saying is epi first, then 911. Because again, once it hits your airway or your cardiac system, you need epinephrine right away. That's the only thing that can stop anaphylaxis. Antihistamines like Benadryl and Zyrtec and Claritin and steroids will not stop anaphylaxis. They may just delay the recognition of anaphylaxis. On the next slide, there are more than 170 foods that are known to cause allergic reactions, but these 9 foods, they're called the big 9, cause 9 out of 10 reactions in the United States. It used to be just the top 8, but last year sesame got added to the list. And the top 9 are wheat, soybeans, fish, tree nuts, shellfish, milk or dairy products, peanuts, eggs, and sesame, of course. On the next slide, we're talking about living with food allergies. Again, Kabanier, he died from the bullying in the UK, and 1 in 3 children report being bullied about their food allergy. My son is 7 years old and just in 1st grade, and he gets teased all the time in the cafeteria. Kids dangling stuff in front of him saying like, can you eat this? Will you die if I touch you with this? Well, that's not all the time, but even with the 504 plan and an IEP, there's only so much that teachers can do. And it's not great to have your child isolated all the time. Some schools do have food allergy tables. However, I don't even know what that means, because there are so many food allergens, it can't be completely allergen free, because one kid can be sitting there who's allergic to peanut, but another kid can be sitting there who's allergic to dairy, and they each have something that the other person's allergic to. But children with food allergies are at increased risk for anxiety and depression, just from the teasing that they get, from being worried that they're going to be exposed to something. And often they're just straight up excluded from classroom and after school activities because of the food that's around. Oftentimes, if there's an after school event, there's usually some popcorn, some ice cream, treats and stuff that not all kids can have. Caring for children with food allergies in the US costs families $25 billion annually. That's a huge, huge cost, and I can definitely attest to that. um, People with food allergies and anaphylaxis may qualify for protection under the Americans with Disabilities Act. And there's been a over 370% increase in anaphylactic reactions, between 2007 and 2016. That data is really old and it's even higher now. I just don't have the most recent number from a source. That picture there, FARE, F-A-R-E, stands for Food Allergy Research and Education. They're the nation's leading nonprofit organization that advocates for the more than 33 million Americans with food allergies. And in March, my son and I went to Washington, D.C. with all those kids and their families representing 47 states to go to Congress and lobby for laws to help food allergy families. On the next slide, we're going to talk about how we can help. So first off is to prevent an allergic reaction in anaphylaxis, but it's not always possible in a public setting, such as school. The best way to prevent a reaction is to avoid the allergen, but often in school, obviously, we can't control what kids are eating and what they're allowed to bring in. And then there's also sometimes classroom projects that include food. And a lot of teachers give lollipops and candy and this is that as treats. But we really should try to focus on offering non-food rewards like stickers, glow sticks, trinkets. But of course, those things are more expensive than just a bag of candy. Something also very big is to wash hands before and after eating, because if you eat something that somebody's allergic to, some people have such severe allergies where if you touch them or something that they're going to eat or touch their eyes or mucous membranes, then they will have a reaction. And it would be great if we could just avoid the use of food in the curriculum. We need to educate students at an age appropriate level, also staff and families on food allergies and how to recognize symptoms of an allergic reaction and emergency first aid. We need to keep epinephrine accessible. Like I said, a lot of people don't know that they have allergies. And even if they do, epinephrine can cost hundreds of dollars, even with insurance. I meet people all the time who don't have EpiPens or they have expired EpiPens because they are so costly. We need to create policies and legislation to protect our children, especially, our children are the most vulnerable and they can't control their environment and what's going on, especially in schools. On the next slide, we're going to talk about training teachers and staff, including before and after care. And before and after care is tricky because, of course, they're not the school, but we need to get the principals and the districts to get on board. OCPS last year, they amended their contracts to say to the third-party contracted vendors that at least 2 staff members have to have training and to be ready to administer EpiPens. However, there's no accountability. And even this year, I found out from other parents, same program that discriminated against my son, that program is still not training all of their staff on EpiPens. And I talked to a school nurse who said, oh yeah, just last week, somebody from the extended day after school came to me and asked for a student's EpiPen, but I couldn't give it to them. So they're still not forming a plan with the families, and the families have no idea. But most allergic reactions happen in the classroom, actually, not the cafeteria. But allergic reactions have also occurred on the playground, on the sports field, clinic, and school buses as well. But there are currently no Florida state laws that require training on recognition of anaphylaxis. I have contacts in the Department of Education and the Department of Health in Florida, and they both confirmed it. There are no state laws. Parents often assume their kids are safe on campus in before and after care, but the staff does not have access to the epinephrine in the school clinic. And again, they're not being told. On the next slide, because the cost, right? How can we afford to train all these staff members? Well, training is fast, easy, and free. Literally that picture right there shows you how to give it. I've got a little training device here, and literally you just pop the top, take off the bottom, and then inject it into the side of the thigh. That is literally all it is. You never get exposed to the needle. And there really is no downside to administering epinephrine, even if a child was not in anaphylaxis. The worst thing that they'll feel is maybe flush or fast heart rate, but you will not do any harm to a child or anybody, even an adult, if you administer epinephrine. Currently, some districts that do train their teachers and staff or offer training, they use their school nurses to do that. Some districts have the school nurses go out to the campus and teach a bunch all at once. Some districts will have a video, a 15 to 20-minute video that teachers can watch, and then they just schedule a 2-minute demonstration with the school nurse. They'll go out to their campus and have them do a return demo. FAIR, Food Allergy Research and Education, also offers a 20-minute free online training course. And after you complete the course, you get a certificate as well. And I did include the link on the slideshow here. American Red Cross and other programs do offer training, but they do charge for those. But it starts as low as $35, but I know that is costly when you add up the numbers. But we really, and Florida has statutes to protect teachers and staff from liability. So they don't have to worry about, oh, what if I don't do it right? Oh, what if I gave it and didn't really need it? They're protected. Okay, on the next slide, we're just going to talk about legislation real quick. So my local representative, well, she's not even mine, she's a district over, but Representative Rita Harris and Senator Linda Stewart this past year filed HB 65 and SB 52, anaphylaxis in public schools. However, it died in committee. It died in Education Quality Committee. So I'm trying to work with that chair of that committee to discuss why she didn't let it be heard. She said something like the Senate or school boards in Florida were trying to deregulate schools. I don't really know what that means, so I'm trying to get clarification on that. But what that bill was trying to do was to require all Florida school districts to adopt policies on anaphylaxis and to require at least 50% of teachers and staff, including before and after care, to train on recognition of anaphylaxis and EpiPen administration. Like I said, that died, but Representative Harris has said that she will work with me to file it again for next year. So I'd really love the Florida PTA and everybody to get on board. Right now, federally, there are those bills that I listed there. The ADENA Act is to try to require over-the-counter and prescription medications to be disclosed for the top 9 allergens and gluten, just like food is, but medications don't have that requirement right now. Dillon's Law is also in session right now, and that was started after a couple lost their son to a bee sting. And then the Congressman Maxwell Frost in Florida, my district, he filed HR 6965, the EpiPen Act, to try to cap the cost of a set of EpiPens at $60. And then I just have some references there. But yeah, thank you guys so much for listening. And I'm happy to hear any questions, comments, anything. Like I said, I touched on before, and this morning we had a discussion about 504 plans and IEPs, and my son does have that, but they're very difficult to navigate because depending on what district you live in and what school and what staffing specialist you have, they will allow some things for others and maybe not for others. Like some examples, when my son entered kindergarten, I requested for his teachers to be trained in recognition of anaphylaxis and EpiPen training, and they told me no, that they couldn't do it, that it wasn't required, that it was just voluntary, but they didn't even offer it either. But as a new parent, I didn't know what to do. So I just accepted that. I asked to be notified at least a week in advance if there was going to be anything in the classroom with food so I could send something in. They said that wasn't realistic, that a week is too much. So we settled on 48 hours. I've heard from other parents that they requested for teachers to be trained. And just this past year, a teacher, I think in Volusia County, didn't feel comfortable with the student's food allergies. So they actually changed his classroom. They transferred him to another teacher. But there's all kinds of shenanigans going on. And before and after care also needs to be addressed. But I know that that's probably out of PTA's jurisdiction. But these are just some things that I'm working on and just raising awareness. Because like I said, food allergies can be very serious. They can be fatal. And I really, really am concerned about the kids who don't have EpiPens, who aren't aware. So yeah, thank you.
Thank you, Sherry. There is a question in the chat concerning how strict are the expiration dates on EpiPens?
So EpiPens, it's such a racket. So they all have expiration dates that are up to a year. So the thing is that the EpiPen, it only costs $8 to manufacture the device. And then the actual epinephrine, the medication, actually has a longer expiration date. However, they can only insure the device for up to a year. So that's why they have such short lives on the EpiPens. But the active medication is still good for beyond. So we as healthcare people, for people, because often our kids and even adults have multiple sets of EpiPens because you should always carry two. So often if you have a student or a child, the parent sometimes has a set, the student has a set, as well as in the clinic. Because if it's in the clinic and a child goes to before and after care, whatever after school activity, they no longer have it. So you have families dealing with multiple sets, and sometimes they do keep expired sets because they can't afford to have 2 or 3 active sets all at once.
Thank you, Sherry.
Yes.
I'm going to go to the raised hand, then go back to the chat. Enrique? We can't, you're on mute, Enrique.
Okay, better?
Yes. Hi.
Thank you. Thank you, Cherry, for the presentation. Early on the noon presentation, Laura Feldman had a long comments about this. I would recommend everybody here to go. I don't want to repeat what she said, but most of you know me and some of you know my child. What may you don't know is when he was in pre-K, we found out the hard way that he was allergic to peanuts because he was offered to peanuts, but we have a good contact with the school because he was medical fragile. And so the pre-K teacher called us that my son had a reaction to peanuts, and we called the pediatrician. He said, hang up the phone and call 911. When that night and the following day in the hospital, and it has been 3 instances, even with the prevention that we have done, that a really reaction to any of the allergens could cost kids their lives. And you put only like 7 or 8 kids, and it's more than that, sadly. I think the PTA can partner with any organization if there's any laws that are coming up in the, it's basically a life and death situation. So thank you for the presentation. I just wanted to make sure that people have a chance to refer to the recording earlier. That way I don't go and tell the whole story of the school system. But awareness in cooperation and having people in the PTA train doesn't have to be in the school, but you know, if we're around. The other thing, I had a question. You said that it's a statute that protects the teachers on that. Can you find what statute is in case, because sometimes we say something and if we don't have it exactly on what it is, they're still reluctant to provide that. But other parents, you know, Good Samaritan laws and things like that are, you know. And as I said earlier, my wife always carries an EpiPen on her purse. And I sometimes go with my son out and things like that. I never carry one. It was one thing that I learned today. Is you know, and I knew how dangerous it is to have an allergic reaction because I have friends and I have heard about the nurses that start dying because of the allergies to the gloves, and also kids with cerebral palsy, because of the charms where the kids were allergic to the plastic, so it's awareness, and it's thank you for your presentation. Oh, it's great. Thank you.
Oh, thank
Thank
you so
you.
much.
Thank
I
you.
have your number from before, so I will message you with the statute.
Okay, I'm gonna go to the chat, then back to the hands. Uh, you'll love this one, Sherry. Are you able, I'll paraphrase, are you able to speak at local unit PTA meetings?
Absolutely. Yeah, absolutely. I would love to.
May I put your email address in the chat?
Yes. Mhm. Yeah.
Okay, all right. While I do that, I'm gonna call on Karen. Your hand is up.
Thank you very much. I was wondering, Sherry, if you had reached out to our legislation chair, Dr. Nancy Lothar, regarding this issue in the legislature, these bills?
So yes, I did when it got filed, and I forget if it was like October, November. She asked me to record a video, and I did. She sent me an email saying she got good feedback so far, and then she ghosted me. I sent a couple follow-up emails and called her. I just wanted to know where we were. Did PTA not agree with it? Were they not on board? But I didn't hear any kind of response back.
Thank you, Karen. Lawrence.
Thanks, Carolyn. Two questions, Sherry. One is I noticed in the presentation there was a picture of an EpiPen, and it seemed like it was in a box,
Yes.
like
Mhm.
outside. And the new area for me, I've seen when people have put the EpiPen in the fridge, and when I asked about this person, they said that it was because it makes it last longer. So which one is it? Is it in the fridge or outside the fridge? Is that just a misnomer that was given to me, or?
Yeah, that's a misnomer. So that the picture of the box, that was actually Lake Highland Prep. That's a private school. And I was shocked. I'd never seen one like that before, the epinephrine in the box, but that is a stock epinephrine that anybody could use if needed. And so I took a picture of that to send to OCPS, but that would be so wonderful if that was on campuses like AEDs are now. So yeah, that's what that picture is. So some schools can do it. I guess, we just need to talk to schools about doing it. OCPS is looking into it. We'll see how that goes. But as far as the epinephrine goes, the medication, there is a certain temperature that it's supposed to be stored at. So that is false. Like if it's not meant to be refrigerated and you refrigerate it, it can actually degrade the medication. I would have to look at the package insert on epinephrine to tell you exactly, but it's not supposed to be refrigerated. Even when we go to the beach and stuff, I have an insulated pack, but I don't keep it like on ice or cold or anything like that. Any medication has like a specific temperature that it's supposed to be at. So yeah, putting it on ice doesn't make it last, or in the refrigerator doesn't make it last longer. But the medication itself, the epinephrine, it can last for a couple of years. But again, it's just the device, and it's just a racket. It's just so these pharmaceutical companies can continue to charge people because they know that we're going to buy the EpiPens, so.
Gotcha. And then my other question was, you said sesame was recently added.
Mhm.
When was that added to the list?
Last year.
Last year?
Yeah.
All right, thank you.
Yeah, you're welcome.
So I added Sherry's contact information, her email address in the chat for those who would like to take advantage of reaching out to her. Sherry, we have a question in the chat. Do you happen to know of an organization that offers free or affordable EpiPens for those without insurance?
I do not. I recently, just this last weekend, walked in and met a girl at the bakery at Publix, and she was a young girl in college, and she was telling me that she has severe allergies too, because I was asking her about ingredients for my son. And she said her poultry allergy is airborne, and sometimes people in the deli, if they leave the rotisserie door open too long, she over in the bakery will start to get an itchy throat. And I was like, oh my gosh, so you carry your EpiPens, don't you? And she's like, no. She's like, I haven't had EpiPens in years because they're too expensive. And I was like, what? Like, you're here working, your throat gets itchy. She's like, I know, but like I can't afford it. And so she's an adult. My son is 7. I offered her to give her some of Lincoln's expired sets. I have a set that expired in January. But I told her she needed to use both of them because of the dose, because she's an adult. And when I gave it to her, she just almost cried. I came home, brought him back to her. She just almost cried. She's like, thank you so much. She's like, I know it's expired, but it's okay. It'll still work if I need it. Thank you. And I did reach out to AviQ. AviQ is a manufacturer. I doubt I'll hear back from them. But these companies know that that a lot of people are going around without EpiPens.
Sherry, follow-up question for you. Is a prescription required to purchase EpiPens?
Yes. Right now, a prescription is required. However, Dillon's law that's in federal, a bill that's on the federal, legislation right now, one of their things is to allow anybody, even without anaphylaxis, to carry EpiPens to be able to administer it if needed.
So I think you said earlier, sort of like a AED?
Yeah.
Okay, thank you. Are there any other questions? I should let everyone know that Sherry actually attended our Orange County Town Hall and shared with us her concerns about children with food allergies and the need to share the information that she shared with us twice so far today that we can in turn share with others, because the recordings of both sessions will be posted because as Enrique said, there was some really good information and good conversation at the earlier session. So please don't keep this information to yourself. Like all of our trainings, the information is intended to be shared with others because a more enlightened membership means for a more enlightened community. Lawrence, you had another question?
Yes, I did, and it's related to the cost of the EpiPen. I know that I think it was with the Inflation Reduction Act that brought it down to, was it $35? But is that limited to certain types of insurance, or is it
That
just
doesn't apply to EpiPens at all.
okay?
There was something recently passed that was for inhalers for asthma. They were going to, I guess all the pharmaceutical companies agreed to cap the cost at $35 for inhalers, like for asthma, but there's nothing like that for EpiPens.
All right, thank you.
Yeah, you're welcome. I can tell you, I'm a nurse practitioner. I have health insurance, but even we have a high deductible plan. So before I hit my deductible, a set of EpiPens for my son costs $435. And so then once I hit my deductible, then it's $50 for a set. But even before I hit my deductible, because I have multiple sets, I have one in the clinic, one on him and one on me. Even when I went through AviQ, the manufacturer's little program, that was $120. So the cost is just crazy. And then, like I said, it costs food allergy families $25 billion annually. That's just on food. That's not even the medication and the office visits and the testing and everything that we do.
It's a wonder that there aren't more children who have passed for lack of having the EpiPen available to them. Karen, you had a question?
Thank you. Sherry, I just want to make a commitment to work with you on this issue. I've been doing advocacy for PTA for a long time. Hopefully I'll be allowed to continue, but either way, I'd be more than willing to work with you on this. You got me.
Thank you so much, Karen. I really, really appreciate that. Sometimes I feel like a one-woman show and like I'm a crazy person out here advocating, but it's so hard. And sometimes I feel like giving up, and then I meet that young woman at Publix. I meet another mom. I hear these crazy things, and it's like, I get it. It's tiring. Like, what are we supposed to do? But I just know, especially as a nurse practitioner, I can't give up. There are so many children at risk here, and it would be one thing if the numbers were dwindling, but they're not. They're rising, and it's going to hit us like a wave. And I don't want to wait until a child dies in Florida before we do something. So I really, really appreciate your commitment, Karen.
Denise.
Thank you, Carolyn. And Sherry, I just wanted to say thank you so much for such an important and informative presentation. And thank you so much for your efforts. Like Karen, count me in 100%. I also have a son who has an anaphylactic allergy, but he has an anaphylactic allergy to all antihistamines. Benadryl closes his throat. Claritin causes petechial hemorrhaging. And again, you don't find these allergies out until you're in that situation. So it is a very serious issue, and thank you so much again, and absolutely count me in. Anything I can do to help, I would love to. And thank you for raising awareness to this.
Thank you so, so much. Yeah, it's crazy, you know, but it sounds crazy when all these people start coming up. Oh, I know so and so with food allergies. But yeah, average 2 in every classroom. So if you talk to your kids, your grandkids, nieces, nephews, they all know somebody with food allergies. And I can't even imagine what it's like as a student to watch a classmate suffer a reaction. And reactions do happen pretty frequently, I think, but there's no statistic on it. We're not keeping track of it. But I do hear from coworkers all the time, oh, so and so, my daughter's classmate just had a reaction and whatnot. And even there was a student here, I have OCPS looking into it. She was a high school senior and she didn't know. In Florida, school districts also don't have to notify parents and students either. But in Florida, in 2016, the Kelsey Ryan Act was passed, allowing students to self-administer and self-carry their epinephrine on them. They just have to get a form signed by the physician. Well, a lot of kids don't know. And I hear from moms, oh yeah, like when they go on a field trip, I just have them bring it. But I just have them hide it in their like backpack and stuff. I'm like, you don't have to hide it. Just get this form signed. But anyway, this high school senior got suspended because an administrator caught her with her EpiPen and she didn't have a form. So the administrator said it was a weapon and they suspended her from school. And I hope she didn't lose her college scholarship. But this happened a couple months ago. And I remember her being concerned that she might lose her college scholarship. But yeah,
Wow.
without any mandates, without any laws, without any regulation, school districts can kind of just do what they want. And like I said, unless a death happens in Florida, it's just flying under the radar now because of so many issues that the school districts have to go through. But yeah, thank you for that though, Denise. Thank you.
Enrique?
Yes, no, it's a follow-up. Two things here. We talk about the more emphasis on food, and it's other allergens that are, like she said earlier, the bees, the stink of insects. Latex is one of the worst because if you have non-latex and you touch the latex, it can cause that. The other thing that I was surprised, the last comment that you make about the kid being kind of Baker acted because of having a weapon, because it was a medicine. I heard the same story, but not recently, over 10 years ago. So,
oh yeah, no, yeah, this was just a couple weeks ago, yeah. Or I'm
yeah,
sorry, a couple months ago.
yeah, I heard the same thing with a kid that was Baker acted because he has an EpiPen because of the needle. Okay.
Mhm.
Thank you.
Thank you, Enrique. Any other questions? So you're getting some applause there, Sherry.
Oh, thank you. So, and sorry that I was on late. Like I said, I don't Zoom very much. My computer crashed on me. It still won't turn on. I'm on my husband's computer right now. But no, I really appreciate all of you. I know I saw some of your faces at the town hall, and then Kay and Enrique, who were on earlier this morning. Thank you again for joining us again to hear my spiel. But I really, from the bottom of my heart, appreciate all of you, especially you, Carolyn, who listened to me at town hall and allowed me to present this and discuss this, because I really hope that we can work to really advocate and protect all of our kids. Because like I keep telling OCPS and lawmakers, it shouldn't matter where you live. You should have equal access and safety and inclusion. for something as simple as allergies.
You're absolutely right.
Madam President, can I ask a question?
Sure.
Thank you. Sherry, you said you were in Broward County, I believe.
Orange
in
County.
Broward, okay, we have over 200 schools. And of that, we only have 137 nurses or some sort of health provider in the schools. So the schools that do not have providers, if a child has a reaction, will they then have to call 911?
So in Florida, every school has to have at least a what do they call it? A health aide. A health
Okay.
aide just requires a high school degree, and then they go through their district training. However, districts do not have to train on EpiPens. They do have to have training on CPR, like first aid CPR, but there are no mandates that they have to have any EpiPen training. However, from what I've heard, most school districts have at least two people on campus trained on EpiPen administration. So there should be somebody on campus at all times, two people at least, that can administer EpiPen. And if not, then then they just have to call 911. My son's school, when he started in kindergarten, they had 3 people trained on how to administer EpiPens. And I said, well, who's keeping track? With COVID and illness and flu, if 2 people are out sick, that leaves 1 person. And what if that 1 person's on vacation or whatnot? But I worked with the principal who reached out to the district. It took him 2 years before they allowed him to offer training to like more teachers and staff. But yeah, I get it. So when I talked to the Florida Department of Health, the senior person, gave me the breakdown because there is a shortage of nurses. Of course, we know that. But that's why we can utilize the free online training from FAIR. They are recognized by the Department of Education and Department of Health. As far as I know, nobody in Florida is utilizing them though. But also, I think Miami-Dade County, the #1 biggest school district in Florida, I believe that they do offer training to all of their teachers, as well as first aid CPR, and it's all part of the training that they do before the school year even starts. So yeah, it would take some work, and it's not like everybody has to get trained on the same day, but they can definitely offer training. There's free training available, or they can use their district nurses to go out to train the staff. And some school districts would require it every year. Some school districts do it every 2 years.
Thank you.
Yeah, you're welcome.
Bert, you have a question?
Yeah, to the previous question with Wendy, they do train some of the secretaries. If they don't have a nurse, they will train some of the secretaries to be a backup, even if they do have a nurse. I know Laura was trained when she was at Crystal Lake to do the EpiPen when she was secretary nurse. So they do train the secretaries. So there is more than 1 person.
That's in Broward County, right?
Yep. Mm-hmm.
Thank you.
I know we're running short on time, but something that I brought up too, that I just uncovered toward the end of this school year, is supposedly to be inclusive, if a child goes on a field trip and has an EpiPen, supposedly that teacher will get training on the EpiPen if they will accept the training. So they can give the EpiPen on the field trip. However, once they're back on campus, they're not allowed to give it. Even if a child has the EpiPen on them, they won't be able to give it on campus. They have to wait for somebody in the front office to come and respond.
Sad.
Yeah.
Thank you, Sherry. Last call. Are there any other questions? Sherry, thank you so much for the information and for being willing to join us not once, but twice today to share not only your concerns, but the great wealth of information that we all have now and that we can all begin to advocate on behalf of. I'm sure that your videos, the copies of these recordings will get a lot of coverage once people leave here tonight and tell other people about them. So again, Sherry's contact information was placed into the chat. If you'd like to reach out to her, she is willing to speak to your local units as well. I'd like to share with you all who are gathered here, if you're not yet registered for Leadership Convention, the deadline for early bird is June 1st, and that's just a couple of days away. So make sure that you register. If you've already registered, you should, if you're actually on Florida PTA's email list and you get our emails, you should know that there's a delegate briefing coming up. The first one will be June 19th at 7 p.m. And then we'll repeat that delegate briefing on July 2nd, also at 7 p.m. For the people here who are presenters or members of the board of directors, make sure you check your email as well, because there are some dates for training for you listed from Florida PTA. If we don't have any further questions, on behalf of all of us, Sherry, thank you. Take care of that little guy of yours. And thank you everyone for joining us this evening. Next week's Road to Success is on, let's double check so you don't leave here without some great information. If it comes up, next week's Road to Success on June 5th. You should make plans to join us. We'll be joined by National PTA President Yvonne Johnson and President-elect Bill Datema. They're going to talk about the upcoming consideration of a national PTA dues increase. So that information will come out tomorrow to allow you to register, but they'll be doing a special presentation just for Florida PTA. So do make plans to join us next week as well. We're counting down with only a few more sessions of Road to Success, and I hope that you will help us to make them successful. Until then, good night, everyone, and thank you for joining.
Thank you, everybody.
Thank you.